Hi, this is Dr. Kevin Smith. Thank you very much for checking out this video on the hidden secret number 8 of why you can still have back pain. In this video, in hidden secret number 8, we're going to talk about a late effect sprain strain. In the previous video, I talked about muscle strains, and what that meant was a sudden motion that caused small tears in the muscle fibers due to overstretching. In this particular case, though, we're talking about the late effects of that if the tissues were never properly rehabbed correctly. People that may have had some kind of an injury, whether it's a sports injury or an automobile accident or a work-related injury or whatever kind of mishap, later on down the road, maybe after 6 months or a year or a couple of years, they may notice that there's some kind of strange ongoing problems that are affecting their back, causing back pain. This can include abnormal muscle function, like your back starts to spasm for no good reason, or it could involve joint stiffness. And what's going on here is that, as I said in the previous video, is that when you injure yourself, the body tries to repair the damage by laying down collagen to try to form scar tissue. And the normal pattern to lay down collagen that's designed by the body is everything is in a straight line and everything's running parallel with each other. And collagen fibers that run parallel with each other have enormous amount of strength and stability. But during scar tissue formation, what's going on is that the body is laying down collagen in a random order, and the strands are going in every possible direction. And what that does is it causes an inherent instability and weakness in that area. It can also cause you to lay down calcium in that area. And when you have calcification of the tendons and the ligaments, that further limits your ability to move, and it further causes weakness in your spine, all of which can contribute to chronic ongoing back pain. Now, the solution to this problem is to restore movement to the joints and to the muscles so that they are moving like they should. So you limit the amount of scar tissue formation, and you limit the amount of calcium, how much calcium is deposited into those tissues. Following the restoration of movement and motion, then you have to make sure that your spine is aligned correctly to minimize the amount of chronic ongoing stress and strain on your joints and your discs. And then once that's accomplished, then we have to strengthen and stabilize the spine to add further protection and to further minimize the destructive effect of scar tissue formation and calcium being deposited in those areas. By restoring motion, alignment, and strength, we are able to minimize those effects and get you back to normal. Well, I hope you enjoyed this video, and I hope you learned something. If you have any questions regarding the late effect sprain strain problems or back pain in general, please feel free to communicate with me through my office at redapplewellness.net. Please also subscribe to my YouTube channel and tell a friend. And again, thank you very much for checking out this video.